Hi, everyone. Welcome to Module 4. We're going to talk about older adult abuse, neglect, and scams. And so this module is really important because it impacts older adults, particularly in digital settings. And we're going to highlight some of the warning signs, how to recognize these scams, and strategies to address concerns for individuals. So, first thing you're going to do is look for cues. Okay. So here's an individual talking to an older adult. You're going to look at the screen and, of course, look at the person, but look at the background of the individual. Okay. And let's see, talking to this individual here and sharing his experience. And in the back, you see these cupboards that are empty. You can ask questions about that. Hey, um, Joe, cupboards are empty back there. Have you eaten today? Okay, these are questions. You can look for cues. What if you see a pile of prescription medication? Older adults have potentially many chronic health conditions and take potentially many different types of medications. What if you saw a pile of medication next to Joe? You can check in on that with the individual. Um, we were talking with someone. We did a training one time, and they were connecting with us. And the background, there was a lot of clutter in the background, similar to that picture there. Okay. And here you have an opportunity to check in with individuals because cluttering or keeping things, or within clinical terms, it's called hoarding, could signal a higher level of need that the person has. Okay. Now, you see here on Joe's head, there's a little mark. Okay. Now, remember, I was talking about older adults, their skin thins as they age. And so maybe you'll work with an older adult and you may see more, looks like bruises on a person's hand, right? But because the thin skin, as individuals age, it could actually be blood, and just a normal part of the aging process, but it could look like a bruise. Okay, so that's what we could be seeing on Joe's head. It could be because thin is skinning and the skin is thinning, and maybe there's a bruise, maybe there's just part of the normal aging process, or it's a bruise. Yeah, you can check in on that with the individual. You have the power to do that um, with folks. Now, you can also listen for cues as well. So use all of your senses when working with people. And so you can listen for certain things. Maybe you're talking on the phone with somebody, and you could listen if there's arguments in the home in the background. You could hear individuals. You're listening for non-sequential thoughts. So you're actually talking with the person, and the thoughts are maybe not following a certain pattern. You can check in on that. It could be a sign that someone is experiencing anxiety. Could be a sign older adult is experiencing sadness. It could be if they have a diagnosis of bipolar disorder. It might be mania. You can check in on those things. Now, look for changes in noise level, tone, speech when another person is close. So you're talking with somebody and you're having a normal conversation and you're on the phone, and all of a sudden they start whispering. What does that mean? So someone has come in the room and now they're whispering. They're hiding that they're having a conversation with you. Now, that could be a cue that they don't feel safe with that person. So continue the conversation. And once the individual leaves the environment, you can check in with the person. Do you feel safe? Okay, we're going to show you how to go through these things. So, and also look for the speech rate for an individual. Now, we know older adults may process things slower, so they may talk a little bit slower. But if the speech rate is changing and they're talking really, really fast, it could mean a lot of things. It could mean they're really excited to talk to you, so don't never forget that, right? Could be anxiety, it could be mania, it could be so many different things. Whatever it is, just notice it and check in with people. And you may find out that their family member is coming to visit them, and they're really excited. Okay, or you may find out that something else is going on, and they're feeling some other type of way. Okay, and you can dive into that. Now, during the COVID-19 lockdown measures, it was actually putting a lot of older adults at risk. What was actually happening is that the older adults, um, protective service workers were no longer able to go into the environment of the older adult to see, to check out the environment, to look for those things like maybe the pill bottles, the empty cupboards, or whatnot, to make sure people were safe. And so there was actually a lot less people reporting older adult abuse at that time. It was a huge downturn. Okay. And so it was just a major thing that we really started to focus in on back in 2019. So, how do we recognize these signs? And so, approximately 1 out of 10 Americans aged 60 plus have experienced some form of older adult abuse. Okay, it's about 10%. As many as 5 million older adults are abused each year. And one study estimated that only 1 in 14 cases of abuse are reported to authorities. Okay. So, what are the warning signs? So, for emotional abuse, the warning signs as you're interacting with people, unexplained withdrawal from normal activities. You're working with Betty. She goes to the senior center every Friday to spend time with her friends. She doesn't go, then suddenly she doesn't go anymore. Okay? You can check in on that and say, "Hey, oh, you're not going this Friday. Tell me more about that. How come you're not going?" And it could be older adult abuse, but it could also be other things too. That's why we want to check in. A sudden change in alertness. Remember, we're talking on the phone to a person, somebody walks in, and then they talk really quiet. Sudden change of this alertness, okay? Unusual depression. So out of nowhere, someone will be starting to experience depression. And older adults likely won't say the words, "I feel depressed." Many older adults don't use that terminology. People may say, "I'm feeling sad." Or if you're working with an older adult who's an African American, they may use the term, "I'm feeling blue." Okay. And all of which individuals will more likely report psychosomatic symptoms. Remember I said that? And that's just aches and pains. So physical complaints of the manifestation of sadness and depression within a person's system. So it could be stomach aches and that kind of stuff. You might hear some of that. Strained or tense relationships or frequent arguments between the caregiver and the older adult. Now, for physical abuse, you may see bruises, you may see pressure marks, broken bones, abrasions, or burns on an individual. Financial abuse will be a sudden change in a financial situation. Neglect, people may see bed sores, unattended medical needs, poor hygiene, unusual weight loss. And then verbal and emotional abuse. You may even hear belittling, threats, or other use of power or control by the individual. And the older adult might report this to you as well. Okay? So let's go through some true or false about this. Now, when we think about scams for older adults, educated people don't fall for scams. Why is it just older adults? Well, the answer to that question is false. Older adults are actually targeted for scams. And so that's why they fall for them more so than younger adults. They're actually on a list and they're targeted. Um, so when we think about abuse, what can we do to address abuse if you are suspecting it? You can have a private conversation with the individual or an attempt at a private conversation, making sure the individual is safe. And you can use a code word. So, one story is that a person was serving another person through video conference, and they actually wrote on their hand, "Help." And so, when they were talking with them through the video conference, they were going like this so they could see it. Okay, help. Or people use code words to say if somebody's coming in the room. Maybe the code word you agree upon is, pizza or something like that. And so then as you're working with someone, you know that someone else is in the room, they can't talk openly about things. So, a few things you can do if you suspect this, okay? So you can ask indirectly. Do you feel safe where you live? Who prepared your food? Does someone help you with your medication? Who takes care of your checkbook? And even for me, asking indirectly, I feel very uncomfortable doing it. So what I have done in the past is that I'll literally write down these questions and I'll just read them off when I feel like semi comfortable. Because even these questions were hard for me to actually ask to individuals, and so it was just easier for me to read it. So if you're in a similar situation and working with individuals, you can write these down and ask individuals. So you can also ask directly as well. And so again, you can write this down too. Does anyone at home hurt you? Do they scold you or threaten you? Touch you without your consent? Make you do things you don't want to do? Take anything that is yours without asking? Had you signed documents you did not understand? Are you afraid of anyone at home? Are you alone a lot? Has anyone ever failed to help you take care of yourself when you needed help? You can ask these questions. Okay. So, true or false? If older adults say they aren't being abused, it didn't happen. Well, the answer to that is false. Okay. Because people, what happens within the family system and family environment, we generally, from different types of theories, we protect the people around us, or people may not even know that they're being abused. So you do have options. You can report older adult abuse and neglect, and so you can do what you can do is go onto your browser and see how to report older adult abuse and neglect. And so that's one option. However, if you're working within a clinic, you need to talk to your supervisor about what is the process to report abuse and neglect, because their process from one clinic to another, it may be very different. So you want to find out the policies in place. So what we do in one of the clinics that I work in, we have a conversation with the supervisor to discuss the risk factors and some of the things that an individual has seen to determine if the individual is at risk. And so here, after this conversation, the supervisor will report the abuse and neglect, and then protective services will go out and serve the individual. But again, make sure you check within your organization to find out how to do this.